You have Lexicom. If you go into Lexicom and you're given multiple medication, especially IV medication, you have the ability to put the fluid and the medications, and you can print out a compatibility list and post it to your IV pole. So everybody who go in the room, they know if the drug should be mixed with that particular fluid that is in the room. You can also print your compatibility sheet from Micromedas, Trisels, and then if you work in mother baby area like pediatric ICU, neonatal ICU, perhaps postpartum area where you have to give medication to children, you probably are working with the Pink Book, which is a pediatric version or pediatric children and neonatal version of Lexicon, and it's written by Takitomo. So a lot of the time we don't even refer to it as Pink Book. We just say I need Takitomo. Takitomo is the author, but they have different. I put a couple different versions um, for you. Um, it comes in green. This is what 22nd edition. I think right now for the Pink Book we're using 26th edition, and I have the 24th and the um, 22nd edition here. So it can even be, the book itself can be bright green, but I think the original one was pink or something, and people just refer to it as the Pink Book, even though it might not be pink. So institution, if you go into their internet, their site, usually every nurse will log in to that institution and you go to the website, they have resources for you. You might see policy information, you might see individual standards of practice, individual unit standards of practice. You might see, that's where you're probably going to see Lexicon or Micromedas or whatever, and you can go in and print what you want or look for whatever information you can get. To prevent error, of course, we want to look for our, you want to always observe your medications right. Again, however many they are these days. I think we are 8 or something, but hey, the basic 5 always work. And if you have other nursing responsibilities that your establishment has put in place to safeguard patient's life, please observe them. Because if you don't observe those policies, if something happens, you will not be protected. Um, Here are some equipment that we're going to need. So let me go to the next slide. Okay, to start an IV, you're going to need an extension tubing. You can have different type of extension tubing. And with that extension tubing, this is a single lumen extension tubing. You can have double lumen extension tubing. You can even put a triple lumen extension tubing. But most IV kits are probably going to come with single lumen extension tubing. You're going to need an access device. Most facilities are using needleless. Even if you use the rubber tip access device, which I'm going to show you in that next slide, you can still use needleless devices. So I just put the different type of access device that I've worked with in the past. So when you go to a different hospitals, you know that you have the same thing. You're using the same thing. This one, it's lower lock, so your syringes can just you can screw your syringes right into this. And if you see some of them, you have like a pressure that keep things from coming out or things from going in, for instance. This is the rubber access device, and this is different because you're going to need a different type of needleless to kind of poke this. It will look like a needle, but it's a needleless device, and then it will kind of poke this. when you take care of oncology patient, I don't know, you may find yourself on a unit where the access device that I showed you earlier, when the patient comes to the hospital, we switch it to that one. But when they're going home, we usually switch the central line device to the rubber one because you don't have any opening here. Therefore, nothing can really go in. We use that where I come from just because it's just safer. It decreases infection. At least that's the belief behind it. We talked about having the different lumen for your extension tubing. This is a triple lumen one. So if you need a triple, you need to give multiple things and they have to run differently, then you can change your access device or you anticipate that to start with and you know to put the double lumen on the triple lumen instead of the single lumen that may come in your AV kit. Okay, we have different access sites, so now we're going to get into different access. In this picture, what you see is an external jugular. Now, if you look at the external jugular line, it looks like it's a central line because we do put internal jugular line right next to that, right? However, if you look at the catheter carefully, you will see that it's a peripheral catheter that they're using. IJ is not a central line. I mean, EJ is not a central line. IJ is the central line. So assess the patient. Just because something is on the neck, it doesn't necessarily mean that the patient has a central line in place. Whether it's an EJ or IJ, it's in the neck and it can be temperamental. So if the patient has a short neck or they have like a large neck, for instance, it will be hard to keep that line straight. Plus, sometimes the sweat around that area, so the dressing may not always be intact. It's like a hard place to put a dressing on. So for your central line, you may kind of run into some issues when they're putting an IJ. But those are lines that are placed at the bedside. IJ is placed at the bedside. Subclavian is placed at the bedside. Uh, Again, I'm saying at the bedside. I'm used to having it done at the bedside. But maybe your facility has a procedure room where they take the patient to and put the IV catheter in. Maybe they don't even have a procedure room and all the lines are placed in surgical area. Uh, Even though EJ is a peripheral line, is considered peripheral, a nurse cannot place an EJ. That's the policy that I'm used to. Usually we'll have our providers who come and place the EJ for us. It's too close to the internal jugular for you to be playing with that. So usually that's the policy. Nursing, you can put an IV on the heads, like we do in pediatric setting for neonatal, but we don't touch EJ. Um, Here is an IJ, and if you pay close attention, you can see that the um, the catheter, the IV catheter that they use, or the central line device that they use, it has wings, and that wing is placed into a stack lock to keep it in place. So stack lock, it kind of anchor the line in place. A stack lock is changed when you're doing dressing changes. Um, and you just different type of central line. There's a hole on the side of the central line. Some central line are long term and some are short term. We'll be talking about